pain or see a doctor who recommends you take over-the-counter painkillers in any amount or length of time exceeding the FDA advertisement, turn and run. Do you really want to suffer decreased cardiovascular health, ulcers, and a toxic liver in addition to your back pain? I think not. Now, what if instead of recommending over-the-counter painkillers, your doctor chooses to prescribe a narcotic painkiller for your back? These drugs are different from aspirin and Tylenol and whatnot because they are derived from opiates. What does that mean? You guessed it. In addition to the many other health risks, these drugs are highly addictive. You might recognize these substances by their more common names. Perhaps your doctor has already prescribed one of these for your back pain. Percocet, Vicodin, codeine, oxycodone. Do these drugs work? Absolutely, if your definition of working is to provide relief from severe or chronic pain. However, each and every time you take one of these drugs to relieve your back pain, your body develops a greater tolerance. For this class of drug to continue working, you are required to take higher and higher doses. Keep in mind, this class of drug is a derivative of opiate, the same substance used to make heroin. I know it sounds crazy, but it's the truth. Taking these drugs for back pain is a surefire way to dependence and addiction. Not to mention the agony of withdrawal symptoms when you attempt to stop these drugs can be pretty brutal on your body. Whether your doctor prescribes a narcotic or non-narcotic painkiller for your back pain, the critical problem is this: none of these medications actually fix or heal your back. Therefore, as your back pain persists, if you do not seek other help, you must take these drugs in higher and higher dosages to function. In your quest to be free of back pain, you must be careful not to compromise and endanger your short and long-term health. This is critical. Now, some doctors stay away from painkillers with their back pain patients and instead prescribe muscle relaxants. The problem here is that muscle relaxants don't get to the root of the back pain and only force the muscles in the back to loosen up. Meanwhile, the tight muscles are the body's way of protecting a hurting spine. By taking muscle relaxants, you're forcing the body to stop protecting the spine. This is why when most people stop taking muscle relaxants, their back is even more severely damaged and they're in even greater pain than before. This is not something to take lightly. If you choose to seek help from your medical doctor for your back pain, there's one last treatment he or she may prescribe. It's not a drug in the sense that it's a pill, but it is a medication. In fact, it's one of the most frightening treatments of all. Welcome to the world of epidural steroid injections. This is a common choice for treatment of back pain by medical doctors. Here's how it works in a nutshell. In an attempt to reduce back pain and inflammation, pain doctors use an X-ray guided injection of steroids directly into your spine. Does that sound like fun? Does it sound dangerous? Well, the PDR, the guidebook doctors are supposed to follow in prescribing medications, specifically states, quote, suitable sites for intra-articular injection are the knee, ankle, wrist, elbow, shoulder, phalangeal, and hip joints. Joints not suitable for injection are those that are anatomically inaccessible, such as the spinal joints, unquote. Again, joints not suitable for injection include spinal joints. If you're bold enough to ask your doctor whether or not the PDR approves of the large needle he wants to stick into your spine to help your back pain, don't expect a straight answer. If your doctor admits anything at all, he'll probably say the PDR is just being overly cautious and he's injected hundreds of spine without any complaints. Well, ask him why it is then that epidural steroid injections have been banned in several countries around the world. You don't have to be a brain surgeon to realize injecting a syringe directly into your spine is not a safe or natural way to relieve back pain. An epidural injection delivers steroids directly into the very thin epidural space in the spine via a very long needle. And according to studies, blind needle injection, even by skilled and experienced professionals, has been found to be inaccurate in 25 to 30% of all cases. That means if a pain doctor wants to give you just a single epidural injection, just to quote, see if it helps your back pain,